Okay, so that's the acute injuries, and we've used the muscle strain as an example there. Moving on to overuse injuries. Overuse injuries are probably what we spend much more of our time in the clinic dealing with, and that idea of overuse is a really pervasive issue. If you look at this diagram here, we train, we break down tissues purposefully, and we let our bodies heal and recover, and they get stronger as a process. That's the training process, isn't it? If you look at this green spikes, okay, you have that training stimulus, you get weaker, and if you give it enough time, you'll get stronger. Then you repeat the process, you get stronger, and you get stronger, and you have this positive adaptation. From a musculo and skeletal perspective, those tissues will become stronger if you give them that stimulus and then give them the chance to adapt. And it's that time to adapt which is the critical thing. And with overuse injuries, what happens is the next stimulus comes before the tissue's had a chance to recover. Okay? That comes sooner, and you get this degradative process, this negative adaptation where you break down the tissue, you don't give it a chance to fully recover, and you keep doing that and you keep doing it until such time that the tissues break down and you become symptomatic and you feel pain. Now, whether that's in the front of your knee, or whether it's the outside of your knee, or whether it's in your hamstring or your Achilles, the fundamental rules remain the same, okay? It's relative overuse. Again, an underlying weakness is the critical risk factor for this, okay? If you don't have that base level of strength within the tissues, particularly the muscles, you're always going to be at risk of this. Again, overuse is this issue that we've spoken about here, okay? And rest is such an important part of this. Okay? There's also some other stuff you can't do much about, your gender and your age and your genetics. If your parents had problems with their Achilles, I'm sorry, but you're more likely to have problems with your Achilles. There's not much we can do about that, but it's pleasing to know that if we get those two things right, there's really no reason why you should have a problem, okay? And we can kind of acknowledge that they exist, but we don't have to worry too much about them.